I'm Matt Bolton. Um, I'm a graduate student at St. Leo University um, in Florida, and I'm here with Ellen Ratliff, a good friend and colleague of mine. Um, I'm on the autism spectrum. Ellen is interested in working with people on the spectrum. Um, so we've kind of teamed up for this presentation. And so basically what I wanted to do was talk about kind of my journey into PCA as a person on the spectrum, and then as I'm orienting and aiming towards a career in psychotherapy, basically how I conceptualize working with neurodivergent people and autistic people in particular. And so autism formally in the psychiatric and medical world is considered a neurological disorder. The Diagnostic and Statistical Manual in 2013 consolidated several different conditions under the main autism spectrum disorder umbrella. And so all of those terms, pervasive developmental disorder, Asperger's, which has an unfortunate history as a clinical term, all of those are now known in the United States as autism spectrum disorder. Autism fits under the neurodiversity umbrella. And so neurodiversities basically are any of these basically conditions, the things that some label as bipolar, borderline personality disorder, ADHD, ADD, any one of those. It also includes basically any kind of neurological processing difference. And so yes, even depression is considered under neurodiversity. And it holds up this idea that these different ways of being are non-pathological and just really different configurations for how one can be in the world. And so that's how I try to conceptualize autism. And Anna Rutan actually referred to it as autistic process. Talk about that in a moment. But you remove, if I can go back, if you remove all these different labels, what we have are many different neurodiverse ways of being. And so ADHD, if there is such a thing, ADHD is characterized by inattentiveness, hyperactivity, and so we wouldn't consider it under that label. We would just see those traits in the person. So when you consider all of the different aspects of autism or autistic process relative to a neurotypical frame, we can say that autistic people may be considered to have difficulties with socializing. There may be an intense focus on specific things. You might see repetitive or self-stimulatory behaviors, difficulty expressing needs, sensory sensitivities. Typically that involves either enhanced sensitivity or a lack of sensitivity across that continuum. But more generally, we can say that uh, autism, it's marked by differences in language, motor, and cognitive processing. Um, in other words, we just experience the world differently. I did want to mention, however, just to kind of balance the frame here, that many autistic people do need full-time care and support. Um, it can be situationally and functionally disabling in the sense that uh, the form of difference just necessitates the need for assistance. So I wanted to talk about a few different emerging topics. People on the spectrum are hotly debating how they should be referenced. Are they autistic people? Are they persons with autism? Most people, research is finding, on the spectrum prefer identity first language. And so it's that autistic label. They consider it to be depathologizing, and it's a condition that's a part of themselves. Whereas in the medical model, professionals try to basically separate the condition from the person. And so there are various terms that we use. Person or people on the spectrum is most neutral. Personally, I like autism spectrum condition. It's less stigmatizing than disorder. And I like it for its versatility. It references both a medical condition and a state of being. Even though when you use it, you can say, for example, person with an autism spectrum condition, that does sound like medical model person first language, but it actually is referencing an autistic state of being. So it kind of gets around some of those issues and is pretty versatile. Another topic within the advocacy world, Friends Don't Let Friends Light It Up Blue. So Autism Speaks and several other organizations are known for various controversies. And so many autistic people are standing up to those things. Misappropriation of funds, not having autistic people on their boards of directors and advisors and so forth. So one trend that has popped up recently is Red Instead, and they use a rainbow neurodiversity or rainbow infinity symbol to represent neurodiversity within some of those campaigns. Very often you'll see the phrase "nothing about us without us." There's a big push among autistic people to be included in the research process, in the implementation of practice medically and so forth. Another big topic, somewhat contentious, representations of autism in the media. So Julia on Sesame Street, for example, is a new puppet. And we see various other representations in film and on TV. And these have varying degrees of accuracy. They tend to key in on stereotypes, not always positive aspects. You'll see there on the bottom portion of the screen, music. There are some scenes within that movie recently that caused quite a stir in the autism community. Um, so the double empathy problem, basically this is a social issue. And it's essentially what can happen when people with very different experiences of the world attempt to communicate. Uh, so autistic neurotypical interactions uh, tend to not go so well because there's essentially a difference of reciprocity. You're coming at the topic that you're talking about from two different angles, and you're just not seeing eye to eye. You're not connecting. Um, whereas autism to autism interactions tend to work out better, just as do neurotypical interactions. Um, there's a famous quote by Carl Jung who said essentially he was questioning um, whether or not people with schizophrenia are schizophrenic when they're with other schizophrenic people. Um, and that gets at the heart of what we see here. Um, autistic people tend to interact with other neurodivergent and other autistic people better than they do neurotypical people because they are on the same or at least very, very similar wavelengths. Um, they have a very similar frame of reference. And so sources of stress for autistic people presenting for therapy. I actually saw this quote by Art Bohart yesterday in his talk. I wanted to share it, and I think it sums up very well the nature of distress for autistic people, because we have all these different vectors through which distress can be caused, and for the most part, um, it's a social thing. It's conditions of worth being placed on the individual as a child by their parent. It's a peer group conditions of worth. Um, and society, of course, places so many different conditions of worth on us um, for how we should be or must be in the world. Um, but many autistic people um, face stigma and prejudice, and very often, they're having relationship difficulties or just trying to figure out how to navigate different troubling situations socially that are related to stigma or prejudice experiences. And so I'll talk about this in a bit, but uh, empathic listening that person-centered therapists can provide can be extremely, extremely powerful. Um, and then, of course, there are the internal psychological, physical, and medical factors that can distress a person. But generally, I would say those are when you look to the literature, those are a subset compared to some of these social issues. Many of us on the spectrum just want to be heard, and we're not, simply put. So where PCA comes in, part one, typically autistic people are offered medication and cognitive behavioral therapies. And so while cognitive behavioral therapies are somewhat existential in philosophy, they're primarily directive and authoritarian in practice, focusing on the challenging or changing of thinking patterns and behaviors. More problematically for the autism community, applied behavioral analysis, which of course derives from P.F. Skinner's work, seeks to change what are perceived as problem behaviors. So some of the self-stimulatory behaviors that I'll talk about, which are related to sensory stress. Those things might be seen as problematic and conditioned out, or the individual might be conditioned into behaving a certain way in certain situations. But ABA emphasizes being close to rather than being with, implying observation. And where PCA comes in, it just breaks the party up. As far as those other treatments are concerned, being grounded in sociopolitics of emancipation and liberation, we have the being with, therapist as guide, client as expert, and then senses of agency, will to power, and self-empowerment that can come from client-centered work. Historically, it was thought that person-centered therapy couldn't be used effectively by certain people or certain groups who presented with particular modes of being. Rogers' late 1960s work with schizophrenics in Wisconsin was for a long time the main case in point for that. But autism would be considered in some forms in this vein, especially with respect to the fact that many people on the spectrum are nonverbal or have lower verbal ability, or when people on the spectrum enter into nonverbal states, what we see as autistic shutdowns, and I'll talk about that in a bit. Gary Prouty's work, however, in pre-therapy actually is increasingly offering person-centered therapists, and really therapists of any modality, the ability to establish, Rogers' first condition of psychological contact with these individuals who may be contact impaired and withdrawn. And so for those unfamiliar, there are 5 different types of empathic reflection in pre-therapy. And so each one of these gets at a different aspect of personhood and can help to bring the person into a state where they're back in contact with the therapist, and more typical reflections and communication can be resumed. Useful for schizophrenia, psychosis, autism, various ways of being where previously contact couldn't be established. And these are from Elizabeth Summerbeck. I've got a reference in the back. Neurodiversity and the socio-political stance of the person-centered approach. They align very, very well. So both share an ethic of liberation. They're focused on freeing the individual from the typical societal frame and bringing the whole person into being. And they also both seek to depathologize and to view the person within the situation. But there's also a shared drive for authenticity. And Rogers, of course, set out his definition of fully functioning. And we can see, how the different tenets would align with neurodiversity principles. The person who's driven to be more authentic naturally in their authenticity is going to be perhaps more open to their experiences. And really that's the goal of client-centered work. And so it can be really helpful to autistic individuals. I've got a few different slides on considerations therapists should have in mind. Autistic communication styles. So I actually was in a workshop earlier this week where they talked about autistic people as being weavers and concluders. And so a person who weaves in communication, in essence, would stitch a tapestry of different points together, bringing in, various conversational points. Whereas concluders are more blunt and to the point, or might use more flowery language, metaphors, and more complex syntax. And so they might go into a lot of detail and their story to the therapist, and what they're sharing might be something that the therapist has to follow quite more closely. Autistic people also tend to think very rationally and logically. There's a natural drive for people on the spectrum to seek to understand how patterns work. And this line of work has a more empirical basis than the weavers and the concluders. But it's getting at the causality of things, and theoretically that's one mechanism that's thought to drive some of the cognitive processes and behaviors in autism. Because through that style of thinking, they call it systemizing. It's thought that the autistic individual is basically trying to establish control over the world and their inner world. That's where the desire for routines comes from. Theoretically, that's where some of these sensory behaviors that I'll talk about come from. And so we have very literal, often cerebral thinkers, so very cognitive. In therapy, they might get lost analyzing the details of the situation. They might have different patterns of speech, or might be nonverbal, which could be situational. You might need to be concerned about meltdowns, basically the individual becoming overwhelmed from a sensory standpoint. And then also fixations. The individual can become very stuck, if you will, on different aspects and details of events. And so, as I mentioned, the self-stimulation, you see that quite a bit on the spectrum. And these can vary. These vary. So you might get, hand wringing. So they're just sitting there, just kind of wringing their hands, or they're flapping. You might get rocking back and forth. You might get a lot of fidgeting. It's interesting. There's actually been some work in ADHD populations where they've found that people with what would be considered ADHD and some of these other attention-based neurodivergencies, for them, fidgeting is actually a way to concentrate. And anecdotally, I see this in my own life quite a bit. Before the pandemic, especially, I would be in class, and I'm sitting there just fidgeting, constantly adjusting myself in the seat. Uh, and, I've correlated that. That's directly related to the amount of attention I'm paying, um, which, as I'll get to, can be interesting in encounter groups. But you also might see repetitious and possibly inappropriate questioning and commenting within this vein. So sensory emotional processing, these are some of the biggest differences for people on the spectrum. Primarily, I would say cognitive empathizing, so perspective taking, that tends to be somewhat of a lowered capacity relative to non-autistic people. And then you might find that the autistic person in session has difficulty identifying their emotions or the emotions of others. You might also find that some individuals struggle with episodic memory or the generation of mental imagery. Physiological attunement or interoception may be weak, and this would have implications for focusing and other experiential person-centered practices. And I'll talk a little bit about that, my personal experiences with that. Finally, I wanted to talk about the autistic frame of reference. Autistic identity is very often a point of pride or importance for the individual. Many on the spectrum aren't diagnosed with the condition, with the label, until later in life. And so they're not able to get the services they need, or people might not accept them the same way until they have that label for whatever reason. And what we find is that this label, once they have it, is very liberating for them, as much as neurodiversity as a paradigm is. Having that diagnosis for individuals who are older or even young adults is often the first step that they make in discovering who they are and really putting a sense of their personhood out into the world. And many on the spectrum who get diagnosed, once they feel much more comfortable, and that frees them to be authentic. And so that's something the person-centered therapist would want to keep in mind, just from a standpoint of depathologizing. And it's not this label isn't necessarily a bad thing, so long as they're not overly fused with it or fixated in a negative manner. And then there may be a possibly lower understanding of and relating to the self. And that's going to relate to, of course, questions of who the person is. And it's going to be undermined by conditions of worth, and then some of the cognitive and metacognitive thinking about thinking differences in processing. So I just wanted to present that for consideration, and then get on to my experiences. So in encounter groups and therapy, I have found a few different things, a few different themes. I've been fortunate since last August to participate in a really wonderful encounter group, some amazing people, and it's been very growthful experience, to say the least. Um, my way of being in the group, I'm very cognitive, as you can see from this presentation, and so I've had to work through that. Um, and that's probably been the most discordant thing that the group has experienced from my perspective, about me, is that sometimes I can be a little too cognitive for the experiential uh, focus of the group. There are impression management concerns. Is how is my fidgeting being concerned? I'm sitting here, I'm sitting here in the group. We're on Zoom, and I'm sitting here just kind of nodding along in attunement. Um, but sometimes, it may come across that I'm not paying attention. Actually, I'm zeroed in. I've got laser focus. Um, and so that's a concern. Um, and then of course there's invalidation or perceived invalidation, perceived lack of acceptance. Um, the natural human inclination is to help. And so when you're in an encounter group and somebody mentions something, or they say, for example, oh, why are you using the autistic label? Well, because that helps me to conceptualize who I am. And so some of those things can be problematic, but they're all learning and growth experiences, in my view. So I've tried to work through those as best I can. It's a continual process, of course. Crisis counseling. I'm a volunteer with the Crisis Text Line organization, and they provide brief, time-limited conversations. Typically, these conversations will last anywhere from 10 minutes to an hour. Sometimes they'll go up to 2 if you've got somebody who is suicidal and more involved. But the goal of the service is to get people from a hot moment to a cool calm. And the way of practice is almost completely Rogerian. Active listening is the go-to. There's a little bit of directivity, and there's a little bit of, just not necessarily hand holding, but we're going to give you resources if you need them. We're going to, put you in contact with others who can help, in an ethical way. And so that's been a great experience. I've worked with several autistic people already. In the almost 2 months that I've been doing that. And this is text-based, but you can draw analogies to the therapy room. So some people have been what I like to call over-texters, where they're sending you paragraphs upon paragraphs of their problems and what's going on for them and they're experiencing. And then you have the one-word responders. You have people who are just very, very curt, and I guess you could say stuck in what they're experiencing. And so staying with those individuals and sorting through in the oversharing situations is something, again, that in therapy we would see and have to sort through as the therapist and follow along. Okay, what's relevant here? But my experience within that is that the people on the spectrum I've spoken to who've mentioned autism, and that's how I know they're on the spectrum, of course. Those people have been very much helped by the Rogerian listening that we provide at the text line. And so, it's a plus for time-limited, person-centered work. Accurate empathy and being with, I just want to underscore as kind of my closing comment. The client and therapist are in dialogue. The relationship is a continual evolving process that eventually, hopefully, will bring about some change. It's subjective, it's intersubjective, and it's very much about the space in between. Some people call it transference, countertransference. You know, what the client is perceiving in the therapist, what the therapist is perceiving in the client. And that's a very important factor here, because very often, let's say the individual is having trouble with emotion recognition, you can have essentially this borrowed interoception of the therapist, where the therapist is reflecting essentially what's arising in them to the client, and basically fitting that to seeing if that fits with the client's experience. That's one way I see this empathic listening and use of that space as being effective for autistic people, because then that can cut through some of the interoceptive weaknesses. It can cut through some of the cognitive empathy differences, and really lend that helpfulness to the relationship. Relational depth. Mick Cooper has done a ton of work on this. It's basically a state of what Rogers would have described, and I think he summed it up in not the same terms, but essentially as a state of flow with the client. And if you watch Rogers in many of his available videos, he is so in the moment, and that's what the nature of relational depth is about. He reported very often coming out of sessions and not even remembering what was said because he was so in the moment, just genuinely curious about every word. And so I see that as being extremely helpful to autistic people, especially if they've been harmed in previous therapeutic relationships, whether that's CBT or ABA. It's about breaking down some of those barriers and some of those conditionalities of the problematic relationship. Close empathic listening. The word empathy actually comes from the German Einfühlung, and it basically means listening to understand, receive, and make space for the client. Rogers wrote about empathy as being a state of or action of projecting oneself into the client's frame to hear as if one is the client. And I know my experiences in the encounter group, when you have a dozen people totally focused on you, that's extremely powerful. But even one-to-one, when that person's sole concern is understanding your experience, I mean, that is life-changing. And anecdotally, the little bit of research that's available on person-centered approaches with autism and autistic process does seem to show that true close empathic listening can be very, very powerful for autistic people. And so I've just got some notes for further reading here on everything from reference terms to pre-therapy. And I just wanted to leave you all with this quote from Fred Rogers, who was a children's television host, unrelated to Carl Rogers. But it was his television show and embodiment of much of Rogers' philosophy within that led me to the person-centered approach. And I've written about that elsewhere. But I've got my email, my website, and this presentation, I'm hoping to I'll make this video available, but I'll also make this PowerPoint available for anyone who wants it on my website. And so with that, I'd like to stop the screen share and open the floor to discussion. We've got a few minutes, and we can do this. I was thinking, or move the spotlight. I was thinking we could have a little bit of an encounter group, maybe see what your reactions are to my presentation, if you've got any questions, and just go from there, I guess.
I think for me, one thing that really stuck out that you were speaking about is that piece of the importance of having, for many people, the label of, autism spectrum. Because I work with, not exclusively people on the spectrum, but I do have some clients who are on the spectrum, and mostly I work at a university, so a lot of kind of emerging adult aged people. And that's something that I don't know if I struggle with it, but kind of where I come down on having the label versus, because I have clients who I think it's really important to, but then sometimes those very same clients, I feel like other parts of them aren't seen, maybe. And I guess as a client-centered therapist, I'm always thinking, especially when clients say, well, that's my autism, that's my autism, that's my autism. Part of me thinks, well, also it's just you're a person. Right, I don't know if I'm really articulating myself well.
I'm hearing you say essentially that we're more than any one thing.
Right.
But they're focusing on just that one aspect. And that is kind of what I was trying to get at. I think, it's this focus that, to an extent, it's a good thing, but when it becomes just that singular focus that I'm autistic and this is what that means, and they start defining themselves in terms of these characteristics, it becomes all about the attention to detail, or all about perseveration, or whatever it may be that they're experiencing.
Yeah.
How do we help them integrate those experiences and not have that be the sole
right.
focus of their experience?
Right. Yeah. And I think, yes, exactly. So like, how do I still respect that that's an important part of who you are, while also gently reminding that you're a human?
And reminding yourself that too, because all the space between can be sticky sometimes. Anyone else?
I guess those who like the label, I have a feeling that it's something like a relief when they have the label, and that's why they use that so much. But I am with you, Jake. I feel very uncomfortable sometimes. And I have a child who is 8. He's not autistic. He doesn't have autism, but he has a rare condition. And I fight a lot against the label because I know every once in a while people come to me and ask if he is autistic, if he has something related to that. And my spontaneous reaction would be, why? Why do you have to label him? He's just a child, right?
Mhm.
But yes, he has some different behaviors. He's just atypical, right? So I don't like this need people have for labeling, but I really understand why they need that, especially when they are adults,
Right.
right? I have got a person got in touch with me like 2, 3 weeks ago asking if I worked with adults, autistic adults. That was the question. And I said, why? Oh, because I think I am on the spectrum and I would like some help with that. And I'm hoping it is because he was something about 40 years old and he just realized he might be on the spectrum.
Mhm.
And having that label would be like, oh, okay, that's why I'm so different, right? So I understand this label thing. And also, I am a mom. I know, especially, I am from Brazil, okay, in case I don't remember if I said that. And I know that in Brazil, if a child with autism needs therapy, we can have that. We can have that in our public health system or paying for that because it's not that expensive. But I know in America, it's not like that. In America, in order to have all those therapies they may need, you need the label, right? You only get the therapies and everything you need unless you have the label. So you have to be okay.
Yeah. Yeah.
And that's what. Go on, Jake.
No, sorry, go ahead.
Oh no, I was just going to say, and that's one reason why I like the autism spectrum condition label, because if we're going to label, can we do it in a way that's not stigmatizing? Can we do it in a way that removes as much negativity as we can? I really like that term as referencing a state of being. At the same time, it references, maybe that more medicalized side of things. And so the way I see that duality is essentially that the individual can see it as a state of being, and then the medical system can see it for what it needs to see it as to get them the support.
We talked about using the term autism process as also in the being stage where it's separating the label from the way of thinking, right? Because I think there needs to be a difference between like, oh, everything is because of this condition, this because it's like, disorder, autism speaks, considers autism as an epidemic, which is, really negative light. It's not something you can catch, right? And really separating that as the autism process. And it's more, I think it's like a gentler term, really, to where it's humanizing, it's more empathizing, it's easier to understand. I think that's kind of important in a therapeutic relationship.
Yeah.
Well, and two, I mean, we can take that from a person-centered perspective. Rogers talked about, of course, the actualizing tendency, and oh, my dog is barking here. But Rogers talked about the actualizing tendency. He talked about the process of becoming, and I think when we refer to things within that context, whether it's autistic process, schizophrenic process, bipolar process, whatever they use it for in the literature, in the person-centered literature, I think that we can rope it into that process of becoming. It's how people with these different classifications or characteristics become within their own internal process, if that makes sense.
That and maybe I'm not understanding what you're saying, but what I'm hearing is it's part of like having that identity in some ways useful to their developmental process
Right,
of becoming
exactly.
whole.
Exactly.
I think that's really an interesting idea. And I wonder if I think that could be such a global idea too, right? Because when I think about any identity that I have, in some ways, maybe that's helpful to me. And yet it's helpful to me developing the way I want to develop. And yet at the same time, I think if I really take a global view, none of them really capture the essence of like me as a human, right? But they help me maybe construct some sense of identity, but they're all kind of reductionist in some way and not truly representative of like me completely.
I think many adults who are undiagnosed find that, especially females who are way more unlikely to be diagnosed, find themselves, masking a lot. They're wondering why, like, they don't fit in. So they force themselves to be, using that logical process, the rational process to look at social interactions and say, okay, well, they're, it's very behavioral logical to mask their, not the misunderstandings, I guess, of socializing. And I think that's really stressful if they don't have that label. They're like, oh, maybe I'm just, like I'm weird, I don't fit in, and they don't understand it. It's internal conflict that a label might be able to help. Like, like this isn't, you aren't abnormal. There's many people who go through the same issues as you do, and the label helps find a community, I think. So,
I'm hearing essentially it's about taking the quote unquote weirdness or oddity out of the equation. You think about a clinical vignette, and I've used these in research, so that's why I mentioned them. If you provide the label to the list of terms and characteristics, that provides people with a frame with which they can organize those characteristics. So they're not as strange, they're not as unusual. You can say, oh, this is ADHD, or this is autism. And so yeah, I see your point, I think.
Right. Yeah. This is slightly off in another direction, but another thing that I was really thinking about during your presentation was when you were talking about the therapies that people typically receive, social skills training or something more behaviorally oriented. Some of the clients who I've seen on the spectrum will come in and that's kind of what they're expecting or wanting. Just because I think that's what they've experienced. And then they're a little uncomfortable with something that is a little bit more client-centered, non-directive. And yet a common concern that I hear is, I can do the superficial skills, I can make these immediate connections, and yet it's really those depth relationships that I want and I'm not having. I mean, they may not say it in those words, but that's what they're saying oftentimes. And so we sometimes have to get to a point of, well, I don't know if more behavioral interventions and skills training, I think that's what got you where you are, right? And if you want something deeper, we're going to have to try something different. And so I don't know if anyone has any, I would love thoughts or insights on kind of helping people on the spectrum develop that ability to go deeper. I think it has something to do with authenticity, maybe, because I imagine if everything you're doing is derived from social skills training, there's probably not a lot of authenticity there.
So my encounter group is there's a heavy focus on the self. It's the guy who runs it actually calls it an encounter with self group. It's not just a typical encounter. We do meditation, and we do some of those more experiential things, focusing, from Eugene Ginland. And I find, and one of the reasons I mentioned it with the interoception, I find some of those exercises difficult, particularly focusing. I find that I have to do some regular meditation before I get into some of Ginland's work. But I think sitting with the experiences, and that's a stepping stone, to authenticity, because when you can, meditation will help you tolerate some of those things that you're experiencing. So if you're an autistic person and you have sensory sensitivity, your nose might be itching. Well, to resist the urge to scratch your nose or to itch your arm or something, when you do that, you can not be distracted by it. So your focus is in the moment. And if you're in conversation with somebody, you're then able to be more authentic. It's kind of building up this resiliency, I find, to be authentic. It's not so much skills training as it is, kind of stepping into authenticity, I find, because even within the contemplative experience of focusing, of asking your problem what it's all about, and then sitting with it, the implicit wisdom that comes from that, is it's developmentally powerful. I think that's where the real self-growth for myself has come. I can't speak for anyone else who would go through such an activity, but I know for me that's where some of the self knowledge has come from.
Okay.
Building that implicit wisdom and sense within yourself that, okay, I've got a problem. Let me figure out what it means or what it's trying to tell me. What is the message in this problem for me or the situation? And from there, you get your self-development, I find.
And I imagine part of that process, it sounds like it's stepping into just the discomfort of confronting the problem more authentically rather than by way of training.
Right. Because you're recognizing with mindfulness or focusing, you're recognizing the experience. You're not training yourself around it or how to deal with it so much. At least that's my sense of it. Some people would say meditation is a skill training, but I don't see it quite that way.
But you know what I think we need? I think we needed more research on that and more writings on that, because all these behavior therapists that are, taking the field, right? It's because they prove, they research, and they show they work, right? And some people are convinced about that. So I really wish we had more, like you did now, right? We need more papers, more articles, more research on PCA to show that, yeah, it works and it's really helpful, right? To help people to be just who they are. Right.
Yeah, I think it's also it needs to be. I mean, to go along with your point, I think we need to have a shift of what we value and what we believe constitutes proof, and do some kind of, I don't know, epistemological soul searching, I guess. I don't know.
Yeah, but as a mom, I gotta say that when you have your, I don't know, 12-year-old son diagnosed with whatever, you don't understand much, right? If your doctor says, oh, you should do ABA, I don't know, right? You just go and do.
Okay. Yeah.
Don't,
Right.
you don't
It's okay.
question
Thank
about
you.
that, right?
Mm-hmm.
Yeah, it's just like, okay, you showed me the way, so there I go, right? In my case, when some specialists told me I should do this and that, I said no, because I don't believe in that. I don't think that works for me, right? But I'm a psychologist. I study that. I know what I like. I know what I think worked, and I've been working with PCA for 20 years now. So no, don't tell me to go to ABA, right? I won't take my son to model his behavior. I want my son to be who he is, right? But when you have sometimes a very recent mom with this diagnostic on her hands, she just goes, right? So anyway,
Absolutely.
so I want to thank you for
Well,
bringing this
thank you
topic.
for coming. I appreciate it. And
Right.
good discussion.
Thank you all.
Yeah, I appreciate the presentation, and it was an interesting discussion.
If you want to share your email addresses in the chat, I can send you a couple papers that I've written.
Yay! Yes, I like that.
and some blog articles maybe.
Okay, because I actually teach for
Mhm.
families. I teach therapists, right, about families with atypical. So any article you have, I would love that. I'm gonna write my email here then.
Yeah. Just throw your emails in the chat, and I'll jot them down real quickly. And it would be good too. We can continue this discussion going forward.
Yes, yes. I'll leave my Instagram in case.
Okay, awesome. Oh, that would be great too. Yeah. I'll just. Okay, let me screenshot of that. And
do we know the recordings, are they going to be on the ADPCA website, or are you just doing this for your own website?
I believe so. I think we as presenters have to send them in, and ADPCA should post them. I'll
nice.
I'll stop the recording now.